The Minister of Health encouraged diaspora dem for make them go back home for invest in the healthcare sector. Well, a very sound good. So if the government of Salone really want make diaspora them contribute na the healthcare sector, one, then get for remove the bureaucracy where people willingly decide for go back home for help, then get for open up for welcome the kind people and they. I remember one time one lady be talk about this. He say when they come on back now diaspora, you go back home for go na the healthcare sector, it's challenging for let them get that open hand for welcome you. They say a really challenging. So if the minister they encourage diaspora they for go back home for start doing their practice, one, then get for open up for welcome them people there. So because say what you mean na sacrifice where somebody say they go back home for practicing profession, or the one that will get more finance where they can open their own service places. Then the ministry need for get that courage there for give them license quick one, so therefore able operate na the various places that we also that need to say it can really challenging where people then go back for set up their own business them for make them get their license, and they some then say that they spend a lot of money for get their license, or if you not get strong connection for make them approve you, it go really money for change all anything. And they the ministry get for open up for welcome people that will willingly decide for go back home for set up their own business then, or if they want for work na the government healthcare sector, therefore really open up for welcome them for work with them, so that the advocacy whether they make people go see say yes this na time this we for go back home for help with people them. But that also government get for play major role for open hand to diaspora. You know, a lot of diaspora they go willing for go home, but are they really welcome to the people where they back home? They not go see you like say you want go take the job na their hand, or they not go see you like say you want for go work with them. So all the challenges there. So the minister then get for look into, and the government itself how for able remove them bottleneck and the way people like feel about, because let's say what you mean now, so it can happen. A lot of people and the way then go back home, they know they feel welcome much because that challenges day a day. So if the minister they talk about make people and go back home for support the healthcare sector, one, the government get for create the enabling environment able support people that way they willingly go back home for support na the healthcare side, so that they go feel belong and they go ready for work for help the community them, for help the country also, so that the healthcare system go be improved. And I hope saying a very good gesture for encourage diaspora they for go back home, but then get for open up, then go for open the space. If somebody go and want for work at the government sector, okay, or if you get in your private practitioner side, when I get the license, get and everything, as long as it proves say in a qualify somebody for doing job, when I for able get, but sometimes they need to say it take a bottleneck. So first when I remove that bottleneck there, so people go be willingly ready for go set up their own businesses them, so that they go able move forward the healthcare in proper way we go benefit Sierra Leone, because that now the advocacy, but then challenges then they when I need for removal. Anyway, thank you and see you in the next video.